As the importance of early life experiences began to become more and more apparent, scientists began to ask, well, maybe we should be looking at what chemical exposures are in childhood and see what the relationship to breast cancer risk decades later. The problem was that we didn't have a good way of knowing what childhood exposures were to many chemicals. Many of them, of course, exposure might be long gone. It was just no way of knowing. Until Barbara Cohen and her colleagues at University of California, San Francisco, gained access to a collection of blood samples that had been collected in the Kaiser healthcare system years and years before, of women who were pregnant at the time, joined a study, blood was drawn, and it was frozen. And those samples still existed in a serum bank. And Barbara Cohen and her colleagues were able to gain access to them, and were actually able to measure DDT levels, both in mothers who were pregnant at the time when they entered the study, so that they could know what the fetus had been exposed to in terms of the actual level of DDT, because the blood was drawn from mother while she was pregnant. And the study that they published this year showed that higher levels of maternal DDT during pregnancy resulted in a 4-fold increased risk of breast cancer in the women offspring of those women. So what was going on in childhood and fetal development was far more interesting and important, probably, than what was being measured in people in their adult life. So there's a story that emerges here from the immigration studies and from the lifespan story that I've told you, that says we need to think about this as an ecology of breast cancer. There is no single thing we can point to here. When people move from Asia to the United States, it's not just their diet that changes. All kinds of things change in their lives. Think about it, the way we move around, the way we relate to each other, the social circumstances that we live in, and so on. If we go to work, we might work at night, we might not have the same sleep patterns, a whole range of variables that change. And we need to think about that as an ecology of breast cancer and bring ecological principles to it and ecological data analysis, I would argue, and bring thinking from the ecological sciences to this difficult question. And I personally think, and I think others do as well, that this applies to many other of the contemporary problems in our communities. Cognitive decline and dementia, it's an ecological problem. Diabetes, childhood obesity, it's an ecological problem. And it can result in throwing up your hands and feeling a lot of despair. But on the other hand, I think that there's good news here, because if you think about it as a complex system that you're trying to intervene in, you can bring systems analysis to it, ecological thinking to it, and begin to identify the strategic places in this complex web to intervene. So you shift the entire operating conditions of the system and not just look for the lawn chemical or the dry cleaning chemical, which may be playing a role. But how do we look at this more complex whole? And to me, that's meant that there's something there for everyone, because we can't all do it all. But we do have our gifts and skills. And there are places in that complex web where we actually do work and have interest. And then to figure out how working in collaboration with others who are working at a different place in that web and thinking about what those relationships are and shifting those system conditions, I think there's actually reason to think that we can take this theoretical complexity and say, what do I do on the ground in my community next week to try to address this problem? So that's where I end up with this.